Hi, I'm Heidi Toby, Vice President of Social Work Programs at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or are just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. On our website, you'll also find a library of ACE-approved continuing education courses to support your license renewal. ASWB Exam Prep, Clinical Documentation. This month's ASWB, LMSW, and LCSW topic is one that's important well beyond the exam: clinical documentation. Even our Code of Ethics speaks to the importance of clinical documentation. Quote, "Social workers should take reasonable steps to ensure that documentation in records is accurate and reflects the services provided. Social workers should include sufficient and timely documentation in records to facilitate the delivery of services and to ensure continuity of services provided to clients in the future." Standard 3.04 from the NASW Code of Ethics. Regardless of the settings you work in throughout your career, clinical documentation will be part of your job. Therefore, today's blog gives an introduction to the purposes of clinical documentation and considerations for clinical documentation. It doesn't have to be as daunting as we sometimes imagine it to be. Clinical documentation purposes. When working with clients, documentation of services provided is of the utmost importance. It serves a variety of functions. While this isn't an exhaustive list, here are a few functions clinical documentation serves. Gives evidence of the services provided, plans for the treatment and care of clients, notes the progress being made towards goals, allows for clear and concise communication amongst team members when working in a team setting, helps ensure continuity of care if the social worker is unable to continue services due to disability, death, serious illness, etc., or legal purposes. If there's no record of something occurring, according to the law, it may not have occurred at all. Should we find ourselves in a sticky legal situation, accurate and concise documentation can be protective for us. Clinical documentation considerations. We always want to keep two things in mind. 1, our records can be subpoenaed, and 2, our clients can request to see a copy of their records. For instance, we do not want to put anything in our documentation that we wouldn't want our clients to see. We must balance the need to provide accurate information while also protecting our clients' confidentiality. We want to document what we need to in order to provide effective services and protect ourselves legally and ethically. Seeking supervision. If you're ever unsure of what or how to effectively document a particular client scenario, there is a clear answer: to seek supervision. On the exam, if it tells us the social worker is unsure of what to do, we should seek supervision. And if it's a real-life situation and we're unsure of what to do, we should take that very same step. We should seek supervision. ASWB Clinical Documentation Practice Question. A social worker meets with a client who inquires what kind of notes the social worker keeps in their file. They express concern that they don't want what they share in a session to be available for anyone else to see. What should the social worker do first? A, honor the client's self-determination by not keeping a client file. B, seek supervision to determine whether they can honor this request. C, discuss what is and is not documented and the situations in which information may be shared. Or D, ensure the client no one can review their file without their consent. The correct answer is C, to discuss what is and is not documented and the situations in which information may be shared. A is incorrect because legally and ethically we cannot simply do away with a client's file. We can honor their self-determination by considering what is and is not documented, but eliminating documentation entirely is unwise. B is incorrect because there's no reason to consult with a supervisor at this time. If the question told us that the social worker is unsure of how to proceed, then we could seek supervision. D is incorrect because there are situations in which the file may be shared without their consent. specifically if the court orders us to do so. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.